All right. The female sexual body, the internal structures. Okay, so just to orient you to some things that we've already talked about structurally, I'm going to use my mouse and hopefully you can see that. But so you'll notice that we've got the vaginal opening, which we were able to see from the external view. Actually, you can see in this picture, and it's not labeled, you can see the labia minora and you can see the labia majora, right? And then you see the vaginal opening. You see the urethra, the urinary opening. And then we can see the glands of the clitoris, which in the other picture we were able to see that you could actually see that protruding area. The skin here that's above it would be the clitoral hood. It's not very well distinguished here in this picture. I want you to follow the clitoris. So we have the clitoral glands, and then we follow it along, and it looks like it's bisecting the urethra and the vagina, and it's not. So don't worry. It's like actually got these two sort of roots, one that goes on the side that's nearer to us and one that goes on the side that's farther away from us. So that's what you're seeing in this picture, is it actually is closer to us than the urethra and the vagina. And then there's actually one on the other side too. The blue thing that you're seeing is the pubic bone, and see this nice layer of fat that's cushioning the pubic bone so that during sexual intercourse, the pubic bone doesn't get harmed. A lot of times girls, teenage girls in particular, are a little self-conscious about this fat pad that's right here, but it's just normal and it is what it is. That's what's there. Now the next structure up on the left there is labeled the bladder. And so you can see the bladder here. You've got the urethra coming up, you've got the bladder, and notice its proximity to this big structure. So I wanted to show you a picture of, here we have on the left the male, and here on the right we have the female. So notice that in the male pelvic region, there's plenty of room for the bladder to expand. Bladders are, like balloons, right? And they can expand quite large. But in the female bladder, it's constrained by other structures around it. So on the male bladder, you have the pubic bone in front of it, and then you have nothing above it, really. Whereas in the female bladder, you have the uterus above it. And so while the female bladder has the same potential capacity, in practice, it feels full sooner than a male bladder does because of that pressure from the uterus being right above it. So in practice, when you got to love studies, when in research they ask, males and females to drink fluids, and then when they feel the need to urinate, like they've got to go, kind of like wait till you've really got to go to like max capacity feeling. When they do those kinds of studies, they find that on average females can hold about 1/3 the capacity that males can before they feel like, oh my gosh, I've got to go. And that's because there are these other structures pressing on the female bladder. I wanted to point that out because I've noticed that in the efforts to say that there are no differences between males and females, there have been some sort of opinion pieces suggesting that male and female bladders are the same size. There's really no difference between them. And that's true, they are the same size. But do they have the same capacity given the crowding in the pelvic areas of the two different sexes? So that's the kind of the misleading part of these arguments that I've seen on the internet. So, all right, let's move on back to the female internal structures. So I was mentioning the clitoris and how it has these two roots. So here's a picture of the clitoris, and see how it has these two roots that go off into the pelvic area. So that it's really well rooted, just like the penis is, right? I showed you that in the pictures of the penis. It goes well into the pelvic area. Same exact thing for the clitoris. All right, now let's keep working our way. Let's do like we did with the male. I started with the testicle and followed a sperm on the way out. Let's do the same thing for the female, but let's start up here with the ovary and work our way out. So the ovary is this white structure. We're only seeing one of the two ovaries that are inside this female's body. The ovary is full of potential eggs. The eggs haven't ripened, but they are all, each of them in their own little follicle. And they're sort of organized in a corkscrew kind of design, right? Where they rotate out, and then the one that's on the outside, it's turned to ripen and be released kind of thing. So you see it looks very bumpy in this picture. That's because of all the follicles that are in there. But the thing is, there's about 150,000 eggs between the two ovaries. So plenty of eggs. If you do the math, the typical female does not have 150 menstrual cycles between puberty and menopause. Females have way more eggs than they're ever possibly ever going to secrete or use. So there's a lot of them in there. It's just that not all of them will ripen before the biological, shut off time happens, which is menopause. All right, so we have the ovary full of these eggs. See this, what looks like a multi-fingered hand sitting on the top of it? That's called the fimbria. Those are the little fingers, the fimbria, that are pulsating and moving and sort of causing a positive suction, as a response to like the heartbeat and movement around. It kind of moves those fingers. And so when an egg is released, those fingers doing this pulsating pattern will tend to suck the egg into the fallopian tube, which is what those fimbria are the opening of. The fallopian tube is actually lined with a bunch of little hairs called cilia, and the hairs are all moving downward away from the fimbria. So if an egg is released and it gets sucked into the tube by those fimbria, those cilia then will move the egg down the fallopian tube. Now, this giant structure in the middle here is the uterus, and there are multiple layers to the uterus. The whitish layer here in the middle is called the endometrial layer. We'll talk about this more in a second. You've got a big muscle layer, mesometrium, and then you've got the outer skin layer. It's not really skin, it's more fascia, but you've got that outer layer. And then finally, at the bottom of the uterus, the outside part of it at the bottom here is called the cervix, and it's the part that opens up into the vagina. So that's how contents from the vagina, such as sperm, can make their way into the uterus, which is then attached to this fallopian tube where sperm could get up and fertilize an egg. It's also that cervix, the opening that will allow menstrual fluid to leave the uterus and go out the vagina. It's also what will allow a baby to leave the uterus and go out the vagina. So that constitutes the main internal structures. One thing that I didn't mention and is not labeled on this picture is this little tiny little blue ball. I'm trying to circle it with my mouse. Hopefully you can see that at the base of the clitoral root here. That is a Bartholin's gland, and it secretes fluid just before orgasm. So that's kind of an interesting structure, and we'll talk about that more when we get to orgasm. All right, so let's talk about some of those female issues. So endometriosis, a really common affliction, a very common condition that a lot of women suffer from. And I say suffer specifically because it's a very difficult condition. Most women experience significant pain, exhaustion, headaches. So here we have a picture cross-section of a healthy uterus. You see all that blood supply that's going to the uterus. You see that there are ovaries, one on each side. You see the fallopian tubes and the fimbria on either side. On the one on the right, they have also included in the drawing the broad ligament of the uterus. These are support structures that help to keep the uterus in place, even as a pregnancy would occur, right? These ligaments help to keep it in place. So this is what a healthy uterus looks like. Here we have a picture of a uterus that has endometriosis, which means that the cells that normally would be lining the uterus in that endometrial layer have escaped and are now adhering on the outside of the uterus. So you can see these blobs that are covering the uterus. Those blobs are pieces of endometrial tissue that with every menstrual cycle, when the endometrial layer is swelling and getting ready for a potential implantation of a baby, the endometrial cells that are outside, on the outside of the uterus, they are also swelling, and that causes significant abdominal pain. Those cells can get all over in the pelvic region, so they could be attached to intestines, they could be attached to the kidneys, they can get all over the place and make significant pain every month. The other thing that you'll notice is that there are those sort of spider web looking things attaching to the fimbria and attaching to the ovaries, and those are what we call adhesions, and they're basically like scar tissue. So now if you have, let's say that this woman is having sex and it's kind of jostling her cervix a little bit and moving her uterus a little bit, those adhesions are going to feel like they're pulling on the ovary, pulling on the outside of the uterus and things like that. And it feels like pain. It feels like stabbing pain. So that's an endometriosis that has adhesions. And here are some of the common areas where those blobs can end up and where those adhesions can appear. And that's basically all over in the pelvic region. Now, how does this happen? Well, what you're looking at, the best explanation for this kind of endometriosis is that endometrial tissue that was supposed to be being shed during menstruation, instead of passing through the cervix and exiting the body, somehow got forced up and out the fallopian tubes into the pelvic cavity, and then attached to whatever it could find. And then it's still living and doing its thing. And every month it receives the hormonal messages to swell and get ready for a potential baby. And that's what causes the pain. So that's what we call the backflush theory. And one thing that really supports the backflush theory is that a lot of women who suffer from endometriosis don't start having symptoms of it until they've been menstruating for a while. So it's not something that happens with the first menstrual period, kind of supporting the idea that maybe this tissue has gotten backflushed out the fallopian tubes, and then on the next menstrual period, then they feel this pain. Now, there's another type of endometriosis that's much more rare. What you're looking at here is the most common kind of endometriosis. Much more rare is where endometrial cells will be found in the brain or in the lungs or in places that they could not have backflushed into. And so the hypothesis on that kind of endometriosis is that maybe it was a mistaken migration during fetal development, that cells that were earmarked to become endometrial cells migrated to the wrong spot. And so they're acting like endometrial cells and causing sharp headaches each month, or migraines, or they cause shortness of breath every month. And it's very cyclical. It only happens, a couple of days every month. And that one's a lot harder to treat. The type that has the adhesions and stuff, oftentimes they'll treat it with birth control pills to prevent the endometrial cells from swelling as much. And then they'll also oftentimes go in and perform surgeries where they'll try and remove the adhesions so that some of the pain would be reduced. It's a lot harder to find a couple of rogue cells in somebody's brain. So luckily, I guess, that if you're going to have to say that you're lucky if you have this kind of endometriosis that you're seeing on the screen, it is at least more treatable than the kind that is thought to have been due to fetal development. Oh, let's continue on with some painful things. Ovarian cysts. Okay, so again, here's that picture of the healthy female reproductive structures. Okay, so now looking at the ovary, I mentioned to you that each month a follicle is supposed to ripen and release an egg, and then that egg gets sucked into the tube by the fimbria. Well, with a person who's suffering from ovarian cysts that are follicular cysts, that follicle's wall, instead of rupturing, it swells and swells like a big old balloon. Like, that's not what typically happens with a follicle. In typical ovulation, it just ruptures and lets the egg out. But here, it's swelling like you're blowing a bubble with your gum. It does usually eventually just rupture, and it'll hurt when it ruptures, but then it's relief from the pain that had been, ongoing as it was swelling. Some women just seem to have a predisposition to develop these kinds of follicular cysts where they just maybe have stretchy follicles or something. And so every month they may experience this. It might just be a random, 1 month occurrence where a woman experiences one follicle that was particularly stretchy and it gave them a real pain. The corpus luteum cyst is the kind of cyst that you would see in a person who has polycystic ovarian syndrome. PCOS, it's usually referred to. And that's where, see how multiple ovaries are swelling? So the corpus luteum is the term that we use for the structure that's holding the follicle. So the corpus luteum is swelling in multiple places on that ovary. And it is oftentimes associated with hormonal imbalances. It can be associated with extra greasy hair or extra body smell, or it might be associated with gaining inexplicable weight, things like that, because it's an indicator that those things are indicators that the hormones are out of balance. And so corpus luteum is typically due to hormone problems, might even be the cause of hormone problems, whereas follicular cysts can be random, or they could be a person has a predisposition to have these. All right, so I keep mentioning the menstrual cycle, so let's talk about the menstrual cycle. I'm sure you guys have all heard that phrase before, so I won't belabor it too much, but I really like this picture that I lifted off the internet that, depicts it as a circle, because that is what the menstrual cycle is, right? It happens in a circle. And it's broken down into two main phases. You've got the follicular phase, which is where the follicle is ripening. And then you've got the luteal phase, where that follicle is degenerating, and we are building up the uterine lining. So follicular phase, we're getting ready to release that egg. The luteal phase, we're recovering from the release of that egg and getting ready for the next one. Okay, now within the follicular phase is menstruation. So you'll notice that the menstrual cycle starts, day 1 is the first day that there is any kind of menstrual bleeding, any kind of bleeding coming from the vagina. Typically, on average, it lasts about 5 days, but it's completely normal for it to be, as few as 3 and as many as 8 in a woman who's not experiencing any kind of hormonal treatments, right? Like isn't on the pill or the shot or any of those kinds of things. So like natural menstruation, typically the typical range is somewhere between 3 and 8 days of active bleeding. A woman who has significantly more days of bleeding might be diagnosed with a menstrual problem called dysmenorrhea. We'll talk about that more later. So we've got about the first 5 days being the actual shedding of the menstrual, the endometrial layer in what is considered the menstrual flow. You'll notice that it's labeled menstruation all the way up to day 7 because, while the woman may not notice anything else still coming out of her, there is still this, phase of shedding that it continues on even as other cells are starting to build up within the endometrial layer. So even as the uterus has been shed, the new cells are getting ready to start building it up again. By day 10, usually we have moved into the phase that we call the ovulation phase. Now I'm going to be a little bit more specific than this diagram. Ovulation is the day that we release the egg, the moment when the egg is released. The reason why it's got this open window, ovulation, between 11 and 18 days is because it's a little tricky to know exactly when ovulation is going to occur for an individual. But if a woman can track her menstrual cycle and know what her first day of menstruation is 1 month and what her first day of menstruation is the next month, and do that for several months in a row, even if her menstrual cycle isn't 28 days, if it is something regular, maybe 1 month it's 26 days and the next month it's 30 days. And you start to realize, okay, yeah, see, it's alternating 26, 30, 26, 30. So my personal average is 28, but mine is never actually 28, right? Like if you track it and really know, what is really super reliable is that the first day of menstruation is 14 days after ovulation. Like that is consistent across virtually every female that's been measured. When it isn't 14 days, it's 13 or 15. It's not, 20. It's right around 14, with the most common being 14 days after ovulation will be the onset of menstruation, because one of the things that triggers menstruation is ovulation, whereas menstruation does not trigger ovulation. So when there is variability in the length of the menstrual cycle, it's almost always on the follicular side. It's almost always how long menstruation lasts or how long the period between menstruation and ovulation is. That's where the variability is. From ovulation to next menstruation is almost always 14 days. So if you can figure out how long your menstrual cycle is, you can kind of figure out when ovulation is likely to occur. After ovulation occurs, the uterine lining is continuing to thicken because it's getting ready in case there is a fertilized egg getting ready to arrive. So during that part that's labeled orange there, we don't have a name for it, but we are experiencing a dose of progesterone and other hormones that will help to maintain a possible pregnancy, things like that. So this is the basic cycle. It is a circle. So once you complete one of them, you just get to do it over again, right? So it is a circle. So I'm going to stop here and we're going to come back and we're going to talk about what exactly is going on during the menstrual cycle. So I will see you in the next phase.